Tobacco, alcohol and unhealthy food and drink are the leading causes of preventable early death and ill health across the UK. Now, the industries behind these products rely on harmful consumption to sustain their business models, and they use sophisticated tactics to avoid regulations that would damage their sales, ultimately protecting their profits at the expense of our health. Now, these products are linked to a range of health conditions such as cancer, heart disease, type 2 diabetes, dementia, and also mental health problems. They place a significant strain on our NHS and social care systems. For example, alcohol leads to more than 1 million hospital admissions in England alone each year. They cause the most harm to disadvantaged communities, meaning they are a major driver of health and social inequalities.
Across tobacco, alcohol and unhealthy food and drink, we see the same playbook of tactics used to delay and disrupt public health policies. These industries prioritise profit over health, using well-worn strategies to resist regulation. A key argument they rely on is shifting blame, suggesting harm is down to individual choice rather than the product itself. They frame consumption as personal responsibility, while ignoring how environments and aggressive marketing shape behaviour. We've seen this before with tobacco. The lesson? Industry tactics repeat, and strong policies, not corporate self-regulation, are the solution.
So tactic number one that these industries use is denying or playing down evidence of harm. And we saw that years ago with the tobacco industry, comparing the addictiveness of tobacco to something like gummy bears. And we've also seen it with the alcohol industry, really trying to underplay the link to alcohol and cancer. Secondly, is they position themselves as part of the solution. And we've seen the food industry do this to great effect, where they'll talk loudly about all the reformulation they're doing across their products, while failing to mention all the new sugary products they're pumping out into the market. And the third tactic we see is distortion of science around harm of the products. So we've seen the tobacco industry, the alcohol industry and the food and drink industry all pump lots of money into dodgy science that tries to discredit or undermine existing evidence about the harm of the products. Tactic number 4 is the distortion of messaging about the harm of the products. So we've seen a lot of unhealthy food and drink brands, for example, pump money into grassroots sports for children, or spend a lot of time trying to overplay the benefits of physical activity and present that as a solution to the obesity crisis, rather than their very unhealthy food and drink products. Tactic number 5 is the use of legal action or legal threats. In the past few years, we've seen the big food company Kellogg's and also the Scotch Whisky Association take parts of the UK government to court over policies that the governments are bringing in to try and reduce harm from these products. And sometimes just the threat of legal action alone can cause regulatory chill, where a government may be less willing or nervous about putting across policies in case of legal action. Tactic number 6 is the use of corporate social responsibility initiatives. So this may be where an organisation funds a charity or funds a charitable initiative, trying to make themselves look like good faith actors. Tactic number 7 is the use of proxies to speak on behalf of the harmful industry. So organisations like the Institute of Economic Affairs have taken money from the tobacco and the alcohol industry in the past and often run heavy lobbying efforts or campaigns trying to undermine government policy on public health. There are organisations like Forest, that's funded by the tobacco industry, and DrinkAware, that's funded by the alcohol industry, that present themselves as neutral charities while actually undermining efforts to regulate these products. And the final tactic, tactic number 8, is gifts and benefits to MPs. So this might be the tobacco industry paying for hospitality for an MP to attend an event, or taking them out for lunch, or food and drink companies running events in Parliament and giving out freebies to MPs.
The good news is that the public overwhelmingly support protecting health policy from the influence of industries that harm our health. A recent YouGov survey of over 13,000 UK adults found that 71% want policy protected from the alcohol industry, rising to 78% for the tobacco industry. The same proportion, 71%, want safeguards against unhealthy food and drink manufacturers. And it doesn't stop there. 78% also support similar protections from the gambling industry. The message is clear. People want health policy to serve public good, not corporate interests.
We know a great deal about how to prevent the harms from smoking, from alcohol, from unhealthy food and drink. The problem that we have is that the industries that profit from the sale of these products are too often in the way of implementing these policies. So we have some clear recommendations for decision makers to prevent that influence from occurring. First and foremost, nobody should be accepting corporate hospitality from these industries. You don't need to go to the races with these companies. You don't need to go to the opera. Second, we need clear rules of engagement. We have them for the tobacco industry, and we need those principles for food and drink and alcohol. Finally, we need MPs, councillors, those making our decisions and formulating our policy to be familiar with the arguments that industry are making, the busted myths that oppose these effective policies, and make sure they're not being hoodwinked to making policy that's in the interest of companies rather than the interest of public health.